So there's sort of two ways to look at screening, and I think one part is that we want to screen patients when they're asymptomatic. So it's great if people have no symptoms, we identify somebody, hey, you're 45 or above, it's time to get colorectal cancer screening done. We know that this is extremely effective. But there's a lot of people who are hesitant, they feel like I'm not having symptoms, there's no reason for me to get this done. Taking a quick inventory of some possible symptoms can be very helpful to identify those patients who may actually be having symptoms of colorectal cancer and would benefit even more from having an intervention done. So things like blood in the stool, decreased caliber to the stool, an unexplained change in bowel habits such as new diarrhea, constipation, abdominal pain, unexplained weight loss, lower abdominal fullness, all these may be signs and symptoms of colorectal cancer. Ideally, we would want to identify those patients before they have symptoms, but if symptoms do develop, those are people who we really want to target and put a lot of effort into. One of the things that we know is that those patients who have moderate encouragement to significant encouragement from their physicians have a 6 times increased uptake of actually receiving colorectal cancer screening. What we do makes a huge difference in getting patients screened. Patient navigation is a relatively new term for things that we've been doing for a long time, which is making sure that patients actually have an assist, a person to help them get through the process of getting an appointment, getting in to be seen, having a procedure done, and then actually the follow-up care that goes along with it, identifying concerns and difficulties along the way, such as transportation or cost, that may be barriers to them actually obtaining that kind of care. Navigation's meant and effectively does those things to make sure that patients are actually seen and can access care effectively. So patient navigation is extremely important. There's multiple studies that show that patient navigation can play an integral role to patients being able to access cancer screening programs, and specifically colorectal cancer screening. It is especially important and especially effective in minority populations as well, where it's been demonstrated to be even twice as effective as it is in the average population.
Having patient navigation is a huge part, and it doesn't have to be anyone who really is, advanced medically trained. It really just takes someone who has the instructions, who's familiar with them, who can be in touch with that patient, help them hopefully in their native language understand what to do and where to be, so that when they show up for their endoscopy, they're as prepared as possible. We have various folks in my office, as well as a surgery center I do endoscopies, who help with this, nurses, call center staff, schedulers, interpreters, and I couldn't do it without them. It's a critical part of what we do.
There are many barriers to colorectal cancer screening, and a lot of them are the same barriers that we have to actually just obtaining medical care. So making sure that not only are these screening tests readily available to patients, that are affordable and easy to access, but also that things are done in the appropriate languages, that they're done at the appropriate reading level, and that we do the kind of things to make it convenient for patients so that there are clinic hours that occur in the evenings or on weekends, and that we have transportation accessible to patients if they do need procedures done, so that they can get to those procedures, because it's not an easy thing for many patients to access those type of procedures locally either.
I think those barriers are one of the main reasons why there's such a discrepancy between rural areas, some race populations, in terms of our screening rates.